Yeah. Hello everyone. I'm Dr. Prashanth Reddy. I'm consultant radiation oncologist. Today I'm going to talk about cancer of lung. First, before starting that, I would like to just give a brief introduction about the cancer. What exactly is the cancer? Cancer is uncontrolled proliferation of cells. Normally, cells in our body keep dividing regularly as per the requirement of the body because due to certain mutations, they divide uncontrollably. That is called cancer. They form either a ulcer or a growth, or in case of cancer of lung, it forms a node. So if any cancer develops in lung or its associated tissues, it's called cancer of lung. So why cancer of lung is very important? Every November we follow it as lung cancer awareness month. There is a particular reason because lung cancer is the one of the most common cancers among males in India. In some registries, it's the most common cancer in India. In some countries, it is still number one cancer. So there are certain misconception about the in the public that like number one, this cancer of lung occurs only in the elderly and it occurs only in Western people, and it's absolutely false. We do see nowadays we are seeing cancer of lung even in the young individuals. Not only that, not in the Western, but the incidence is increasing in even in India. Approximately 1 lakh cases are diagnosed in India. Unfortunately, still people are in belief that cancer lung is very dreadful disease. Once you are diagnosed with cancer lung and death is imminent, and it is absolutely false. If you can pick cancer lung in stage 1, it can be cured. 90% chances of cure is there. So the main intention to follow this lung cancer awareness month is to create awareness among the public about the cancer of lung. As you see in Western countries, the incidence is coming down slightly because of awareness. So that is the intention why we follow November as a cancer awareness month, lung cancer awareness month. So next is why it happens. What is the reasons? What are the causes of lung cancer? Number one cause is smoking. Tobacco, especially in smoking form, is a main cause of lung cancer. And the other reasons are could be pollution. It could be outdoor pollution or indoor pollution. Indoor pollution, like even in olden days, you see people use wood as cooking material, so that could be the reason. And outdoor pollution, everyone knows now, because of increased carbon emissions and industrialization, the pollution has increased significantly. So whatever is the reason, smoking is still the number one cause of lung cancer. 70 to 80% of lung cancers are because of smoking. Does that mean those who don't smoke, they don't get lung cancer? Absolutely wrong. Because we do see cancer of lung in non-smokers also. Approximately 15 to 20% of lung cancer cases are happened in those individuals who has never smoked, and that could be due to pollution, as I said earlier. And one of the reasons, even scientists suggest, it could be because of second-hand smoke. That means you sit beside individuals who smoke and you inhale those smoke. That could be the reason. The other unknown, uncommon reasons could be exposure to radon gas, which is common in Western countries, or those who are working in asbestos industries, or other reason could be those like radiation exposure could be the reason. So whatever it is, smoking is still number one cause, and advise people not to smoke. So the other thing is what is how they how it can be diagnosed. So it is like it is divided into stages. In very early stage, people tend to be asymptomatic. That means they don't have any symptoms. Sometimes it is diagnosed accidentally if they undergo X-ray or CT scan for other cause. Like example, in recent COVID pandemic, there were so many CT tests were done, and some these lesions were picked up in those CT scans. But still, the stages are divided into early, medium, and late stages. In early stages, people, those who they present with cough and blood in the sputum. like those people who are like chronic smokers who smoke for long duration, who has cough and blood in the sputum, we need to rule out cancer of lung. Those who like in medium stages along with the symptoms of cough and blood in the sputum, they present with chest pain because of chest wall infiltration, and they present with shortness of breath. Even in more severe stages, they develop shortness of breath even in resting position also. Like even they sit, even in sleeping also, they have shortness of breath. In advanced stages, once the lesion spreads to other parts of the body, if it spreads to brain, they have like headache, vomitings, they might present with paralysis. Those who has got, if the disease spreads to liver, they present with jaundice, and if it spreads to bones, they present with multiple body pains. It depends on which area it spreads. So how do you diagnose lung cancer? Like there are certain tests, like individuals who has chronic cough, which is not relieved with antibiotics. Most of the time they tend to get medication for tuberculosis, because symptoms of lung cancer and tuberculosis are almost same. Even in tuberculosis, they present with cough and blood in the sputum. Especially in peripheries, they tend to get medication for the tuberculosis for months together till the disease progresses. So that's the reason why simple chest X-ray, sometimes it shows like a patch in the lung which needs to be ruled out. Once if your physician has doubt that there is something in the lung, he advises for the test like CT chest. Once there is obvious growth in the lung, and it is confirmed with the procedure called biopsy. What is biopsy? Biopsy is nothing but taking a small piece of tissue from the tumor, from the growth, and it's subjected to histopathological examination. Histopathological examination means pathologist sees the tissue under microscope, and the doctor will diagnose it what exactly it is. So how do you take biopsy? It can be done through bronchoscopy. Like if it is in the central, a physician puts a scopy like pipe like thing inside your air pipe and sees the growth. If it is accessible, he takes the small tissue. Or if it is in the periphery, if it cannot be done through bronchoscopy, the other method is CT guided. They take the help of CT scan, localize the tumor, and they take the small piece and send it for pathological examination. So the advantage of pathological examination is, one, cancer can be confirmed. Not only that, there are different subtypes of cancer lung which can be made with during doing certain markers. And not only that, certain genetic mutation test, molecular analysis also can be done on the biopsy specimen. So nowadays it's mandatory to do not only biopsy but also molecular testing. Earlier these tests used to be in Western countries, but it's available in India also. The advantage with this molecular testing is we can deliver tailor-made treatment to the individual. Like it's not like one size fits all. We can give individualized, personalized treatment, which is possible with in case of cancer of lung. So once diagnosis is made, the other next step is to know the stage. This cancer has 4 stages: 1, 2, 3, and 4. 1 is very early, 2, 3 is, you can say, it's median, 4 is very late stage. So because our management depends on the stage of cancer. So how do you do staging? We can do CT, chest, abdomen, and brain, or nowadays PET CT scan, which is available in most of the parts. It is the mandatory to do in case of cancer of lung. The advantage with PET CT is it shows us exactly what stage patient is in, where exactly the disease has spread. Is it localized, or it spread locally, or to the chest wall, or surrounding or distant parts? So once CT, not only PET CT, we do MRI brain also to rule out metastasis in the brain. So once staging is done, we have pathology, we have stage. Then next step is how to treat the patient. In very early disease, in stage 1, patient can be subjected either for surgery or radiation. Individuals who are very fit for surgery, they are subjected for surgery. Nowadays, we have wonderful techniques like minimally invasive techniques like videoscopic thoracoscopic surgery, which is minimally invasive and the recovery is very fast with minimal complications. And those who are not fit for surgery, we subject them with radiation treatment. There are wonderful techniques like stereotactic ones where radiation can be delivered in 1 to 5 sittings. So entire treatment will be completed within 2 weeks of treatment. So both surgery and radiation in very early lung cancers are equally effective, and we will choose depending on the condition of the patient. So if patient is diagnosed in medium stages like stage 2 or stage 3, then one modality of treatment is not enough. Patient has to receive multiple modalities of treatment like chemotherapy, radiation, sometimes for surgery, then followed by chemoradiation. So in 2 and 3, we have wonderful drugs like we can give chemotherapy drugs, or we can deliver immunotherapy or targeted therapies. Coming to the radiation, we have great techniques like IMRT, IGRT, or rapid arc, where radiation can be delivered precisely to the parts where we intend to deliver, and surrounding normal structures can be spared. The advantage with these latest techniques are their side effects will be very minimal and patient can tolerate this treatment. So coming to the, if patient is diagnosed in late stage like stage 4, once it spreads to distant organ, then chances of cure is almost nil. Whatever treatment what we deliver is for palliation only. Palliation means our intention is to just to give some relief to the patient rather than cure. It depends on which part the tumor has spread. So in fourth stage, only chemotherapy has a role. Chemotherapy along with immuno and targeted therapy. And we deliver radiation only to those areas where patient requires some relief from the symptoms. So coming to the treatment modalities, we have, as I said earlier, we have surgery, radiation and drug therapy. Coming to the drug therapies, we have different treatments like chemotherapy, targeted therapies and immunotherapy. So what is chemotherapy? It is a drug which we infuse most commonly through veins, which acts on the tumor cells, like it acts on cells which are dividing profusely. So there are certain disadvantages with the chemotherapy. It has side effects like emesis. Emesis means vomitings. Like most of us know, the main complication of chemotherapy is vomitings. Not only that, more dreadful complication is reduce in blood counts. So we have wonderful drugs nowadays, so that we have drugs which prevent vomitings, and not only that, we have drugs which prevents neutropenia, that means reducing WBC count. So with this, patients are tolerating chemotherapy fairly well compared to earlier days once, and they are able to complete the total course of chemotherapy. The next form of drug is targeted therapies. Like I said, while doing biopsy only, we do certain genetic mutation test on the biopsy specimen, which is called molecular testing also. Based on the genetic mutations, we prescribe targeted therapies. Most of those drugs, they come in the form of tablets. That side effects are very minimal and they can be used for prolonged duration. And it is really a game changer. It has increased it is improving the prognosis of cancer lung, because side effects, as I mentioned, side effects are minimal and can be tolerated even in elder patients also. And the other form of drugs are what we use is immunotherapies. Immunotherapies is drugs which normally we have immune system which acts which acts on the cancer cells and try to destroy them. But these cancers, especially in lung, they form they evade this immunity, so that they progress, they divide. So these immunotherapy drugs make sure that it activates the immune system in our body so that they go and kill the cells. So these are the form therapies which are available now. And the wonderful thing is earlier, like before a decade, once patient is diagnosed with cancer of lung, we used to say that patient is going to live maybe 1 to 3 years. If it was stage 4, we used to give him months. But now, because of these various drugs and wonderful radiation techniques, we are able to prolong the life of the patients. We do have some patients who are diagnosed with stage 4 lung cancer who are living for 5 years, 10 years and more than 10 years also with good quality of life. So that is the advantage of recent advanced targeted therapies. So coming to the how can we prevent this lung cancer? The number one and is you have to stay away from smoking. If you are and if you are like it's smoking like 1 2 packs in a day for some particular period of time, I suggest you to reduce, to taper those, and over a period of time to stop the smoking completely. And there is an advantage of stopping the smoking. Once if you stop your smoke for more than a decade, your risk will come down significantly. So I request you, I suggest you to stop smoking. And those who your loved ones, if they are addicted to smoking, please request them, tell them to stop smoking. And second is stay indoors if it outside environment is very bad, as it's happening in our capital New Delhi. So one is the other thing is, as nowadays it's hardly no one uses wood for cooking, but still in peripheries people are using wood for cooking. So the one more thing is someone who is like long smoking for long duration, who has symptoms like cough or blood in the sputum, I suggest you to go and see the doctor. And those who are smoking and who are over 50 years of age, I request you to undergo screening and consult your physician regularly. Screening can be simple test like a chest x-ray, or if they have any doubts, they will test your sputum for malignant cells. So the advantage of screening is we will be able to diagnose before you develop symptoms. If it can be diagnosed in stage 1, as I said earlier, it can be cured completely. 90% of cure chances are there if it is diagnosed in stage 1. So with this, I request you to undergo screening regularly. Those individuals who are smoking for long periods, who are over age of 50, please undergo regular screening. And those who are smoking, I request you to stop smoking. And one more, because it's very common, second hand smoke is common in our country, because the husband smokes and the family members sit around them and they take that smoke also. I request them to not to do that. I request, if they are not able to stop smoking, at least do not smoke in front of your family. In that way, you will be able to save your family members also. With this, I have covered all the aspects of lung cancer. If you have any questions, please type them so that I will be able to answer those questions. Any questions?